What if I told you that your brain could be silently declining right now, and you might not even notice it? From constant fatigue to sudden mood swings, there are early warning signs that millions of Americans are ignoring. The scary part? Ignoring them could put you at risk for serious cognitive decline, memory loss, or even neurodegenerative diseases later in life. In this video, we're going to reveal 12 early symptoms of poor brain health you should never ignore, why they happen, and exactly what you can do to protect and improve your brain starting today. Stick around. You'll want to know all of these before it's too late. 1. Frequent headaches. Most of us get headaches occasionally, usually from dehydration, stress, or lack of sleep. However, if you're experiencing headaches more than 10 days per month, it could be a sign that your brain isn't getting enough oxygen or blood flow. Causes: high or low blood pressure, anemia, low red blood cell count, chronic stress affecting blood circulation. Solutions: stay hydrated and maintain a balanced diet rich in iron and vitamins. Include aerobic exercises like brisk walking or cycling to improve blood flow. Consider supplements like omega-3 fatty acids, which support brain circulation. 2. Waking up frequently at night. If you often wake up in the middle of the night and struggle to fall back asleep, your brain might be under stress. Frequent awakenings can be caused by high cortisol levels, the stress hormone that affects memory and brain function. Causes: chronic stress or anxiety, disrupted sleep cycles, overstimulation from devices before bed. Solutions: aim for 7 to 9 hours of quality sleep per night. Try relaxation techniques like meditation or deep breathing before bed. Consider magnesium L-threonate supplements to help regulate sleep and improve memory. 3. Brain fog. Do you feel mentally sluggish or have trouble concentrating? Brain fog is a sign that your neurons aren't firing efficiently, which could be due to low blood flow, insulin resistance, or lack of sleep. Causes: high sugar and refined carbohydrate intake, insufficient deep sleep, chronic stress. Solutions: reduce sugar and processed foods in your diet. Include brain-boosting foods like blueberries, leafy greens, and fatty fish. Try nootropic supplements like ceticoline or Bacopa Minieri for cognitive support. 4. Mood swings. Sudden mood changes, irritability, or anxiety may indicate poor brain health. Blood sugar imbalances and inflammation in the brain can directly affect your emotions. Causes: fluctuating blood sugar levels, leaky blood-brain barrier allowing toxins into the brain. Hormonal imbalances. Solutions: maintain a balanced diet with protein, healthy fats, and complex carbs. Consider omega-3 supplements for mood regulation. Engage in stress-reducing activities like yoga, journaling, or walking outdoors. 5. Depression or persistent low mood. Depression often signals long-term stress and chemical imbalances in the brain. Low dopamine, serotonin, or acetylcholine can leave you feeling unmotivated, fatigued, or emotionally numb. Causes: chronic stress and unresolved trauma, brain inflammation, poor diet, and nutrient deficiencies. Solutions: cognitive behavioral therapy, CBT, to retrain thought patterns. Herbal remedies like rhodiola or St. John's wort, with a doctor's approval. Regular exercise to boost natural neurotransmitters and mood. 6. Dizziness or poor balance. Frequent dizziness can indicate poor cerebral blood flow or nutrient deficiencies, especially in vitamin B12 or iron. Your brain relies on oxygen-rich blood for optimal function, so anything that limits circulation can affect balance. Causes: low red blood cell count, poor circulation or cardiovascular issues, inner ear problems. Solutions: eat iron-rich foods like spinach, lean meats, or legumes. Include vitamin B12 supplements if needed. Practice balance exercises or yoga to strengthen coordination. 7. Anxiety or overthinking. Persistent anxiety may indicate an overactive amygdala, the part of your brain responsible for fight or flight responses. This can affect sleep, focus, and overall cognitive health. Causes: chronic stress and elevated cortisol, neurotransmitter imbalances, poor lifestyle habits like lack of sleep or exercise. Solutions: limit caffeine and sugar, which increase anxiety. Practice mindfulness meditation or breathing exercises. Consider supplements like L-theanine or magnesium for calming effects. 8. Difficulty learning or retaining information. If it's hard to learn new skills or remember information, your brain may not be efficiently transmitting nerve signals. Causes: low acetylcholine levels, key neurotransmitter for memory. Insufficient brain energy due to poor glucose utilization. Chronic inflammation. Solutions: include choline-rich foods like eggs, liver, or fish. Engage in brain training activities like puzzles, courses, or learning a new language. Take ceticoline or alpha-GPC supplements for memory support. 9. Restlessness or inability to sit still. Constant fidgeting or an overwhelming need to move may indicate hormonal or neurotransmitter imbalances, often associated with dopamine, norepinephrine, or cortisol levels. Causes: hormonal imbalance, ADHD or ADD tendencies, high cortisol from stress. Solutions: incorporate regular physical activity or short exercise breaks. Try stress management techniques. Consider targeted brain supplements after consulting a healthcare professional. 10. Trouble with language or communication. Difficulty finding words, understanding, or articulating thoughts may indicate early cognitive decline. This is often linked to reduced neuron connectivity or shrinking brain regions. Causes: poor blood flow or oxygen supply, neurodegeneration due to aging or lifestyle factors, chronic inflammation. Solutions: engage in regular mental exercises like reading, writing, or conversation practice. Eat a nutrient-rich diet including omega-3s and antioxidants. Maintain social interactions to keep the brain active. 11. Short-term memory loss. Forgetting recent events while long-term memory remains intact can be a sign that your hippocampus isn't functioning optimally. Causes: nutrient deficiencies, B vitamins, omega-3s, chronic stress and poor sleep, insulin resistance affecting brain energy. Solutions: take B-complex vitamins and omega-3 supplements. Get quality sleep and practice good sleep hygiene. Use mnemonic devices or note-taking to reinforce memory. 12. Chronic fatigue or low energy. Feeling constantly tired even after sleep can indicate your brain isn't receiving the nutrients or oxygen it needs. Chronic stress or overwork may also contribute. Causes: poor nutrition or dehydration, hormonal imbalances, chronic stress or burnout. Solutions: stay hydrated and follow a nutrient-rich diet. Include regular aerobic exercise to boost blood flow. Take magnesium L-threonate or adaptogenic supplements to improve energy and stress resilience. Causes of poor brain health. Understanding why your brain may be struggling is key to reversing it. Some major causes include diet. High sugar, processed foods, and unhealthy fats cause inflammation and insulin resistance. Chronic stress. High cortisol levels shrink key brain regions like the hippocampus. Sleep deprivation. Poor sleep affects detoxification and neurotransmitter balance. Head injuries. Trauma can have long-term effects on cognition. Toxins. Heavy metals, pollutants, and unstable vegetable oils damage brain cells. Nutrient deficiencies. Lack of omega-3s, vitamin D, B vitamins, or choline reduces neuron function. Poor circulation. limits oxygen and nutrient delivery to the brain. How to improve brain health. You can take steps to repair and enhance your brain function. Exercise regularly. Aerobic workouts increase blood flow and stimulate neurogenesis. Eat brain-healthy foods. Include fatty fish, blueberries, leafy greens, and eggs. Supplements. Consider omega-3s, magnesium L-threonate, ceticoline, or clinically backed nootropics. Sleep well. Aim for 7 to 9 hours of deep sleep to balance hormones and repair neurons. Reduce stress. Meditation, yoga, and mindfulness practices lower cortisol. Brain training. Solve puzzles, take courses, or learn new skills to enhance neuroplasticity. Intermittent fasting. Improves insulin sensitivity and supports brain cell regeneration. Sunlight exposure. Boosts vitamin D and melatonin, protecting against inflammation. Avoid harmful oils. Replace vegetable oils with stable fats like coconut oil or grass-fed butter. Limit sugar and processed foods. Reduces inflammation and supports optimal neuron function. Conclusion. Your brain is your most valuable organ, and even subtle signs can indicate it needs care. From frequent headaches and brain fog to anxiety, memory issues, and fatigue, ignoring these symptoms can put you at risk for long-term cognitive decline. The good news? The brain is capable of healing and regenerating through neurogenesis when you adopt the right habits. Prioritize sleep, nutrition, exercise, and stress management, and consider clinically backed supplements to support brain function. Start taking action today. Your future self will thank you.